Hello friends, I am Dr. Surajit Ghosh speaking to you from Kolkata, India. I am the creator of Dr. Ghosh Presents channel. Today the issue of discussion is constipation. The heading being suffering from constipation. Manage it without medicine. Main cause of constipation is hampered peristalsis. Peristalsis is the alternate compression and dilation of intestinal muscles by which semi-digested and semi-solid foods moves along the intestine towards anal opening. Now, let us know the factors upon which peristalsis depends. More or less, 6 factors control peristalsis. Number 1, health of circular muscles of intestine. This is the most important factor. Unless one understands this, one would never try to manage it without medicine. The foods and drinks we take contains different types of mycotoxin. Action of these toxins is so mild and light that we cannot feel it. Acting for a long time, these toxins make intestinal muscles semi-paralytic, so peristalsis action becomes weaker and weaker. Thus, constipation starts. Moreover, these toxins are absorbed from intestine by portal vein and carried to liver. Toxins damages liver cells. As a result, blood pressure in hepatic vein increases and thus piles are formed. Please mind that constipation, damage of liver cells and piles are interrelated. Foods that are fried in trans fat mixed with adulterated spices or kept in cans, packets for a long time contains high amount of mycotoxin. Interestingly enough, these are the foods we cherish most. Just look. The less we take such foods, the better. But one can make these foods less harmful, mixing pieces of cucumbers, tomatoes, and other such things with this, and one may prepare such foods at home with oil and materials of one's choice also. Number 2, water intake. Please remember, water keeps the food in intestine semi-liquid so that it may move along the intestine easily. If one drinks less, the digested food will have a hard consistency and intestinal muscles would face difficulty to push the same along. If physician does not forbid, one should take 2 to 2.5 liter water a day. Number 3, physical movement. Those who lead a sedentary life would face constipation more unless they take active exercise during some time in the day. I think the reason is known to all. We take this issue later. Four, peristalsis action is also dependent on types of food one takes. Food should be a balanced mixture of protein, fat, carbs. We all know it. But one most important practice many of us fail to adopt is to take considerable amount of fruits and salads daily, and along with staple foods of lunch and supper. Sensible men of advanced countries take now a regime of 5 fruits a day, and we? Many say why we take veggies daily, but the mode of preparation of veggies, frying with spices and oil in a high temperature, make the veggies less of its goodness. Fruit salads are taken green. The veggies we prepare can seldom do the job of fruits and salad. Kindly listen to this. Fruits and salads are toxins natures. Cooked food at high temperature with spices and oil must contain mycotoxin. Further, there are a group of foods containing high amount of free radicals which damage our body. When we take fruit salads with staple foods, we get twofold benefits of fruits and salads. Number one, we do get vitamins, minerals, carbs, antioxidants, and other nutrients from fruits and salads. Number two, the innocent cellulose fibers or so-called roughage, the part we cannot digest, of fruits and salad would absorb the toxins and free radicals and go out of the system with stool. This is natural toxin clearance. Am I clear? If this is not clear, please read again. If you take fruit salad separately, that is not with staple food, the number one benefit would come, but you would get the number two benefit because interleaving of foods and fruits are most important. If you do not follow my point, please read once again. Please make the practice of taking fruits and salad along with staple foods a family culture. Everyone would be benefited. Many other benefits of this practice would follow. Pictures of piles has been shown. Since it is related to constipation, that's why this has been shown, but directly it is not related here. Fifth factor that constitutes peristalsis is tension of mind. Everyone knows that mental tension creates trouble in movement of stool in the intestine. So to relieve mental tension, get physical exercise regularly at your convenience. If you cannot manage anything, just walk. Yes, just walk 2 to 3 kilometers a day. You won't get any better medicine than this to lessen mental tension. Sixth factor is liver and gallbladder. Healthy liver secretes healthy bile. This bile is stored in gallbladder. When you take food, bile from gallbladder comes down the first part of intestine to mix with semi-digested food. Healthy bile helps in digestion of fat and helps in peristalsis action too. How to keep liver healthy has already been discussed. If liver is kept healthy, bile would be healthy, so gallbladder will remain healthy. Good bile will keep peristalsis action steady. A simple procedure to keep bile healthy. Chew just one green leaf of neem tree with a sip of water thrice a week in empty stomach in the morning. Please do not harm neem tree while collecting leaf. Just take one leaf. Do not waste. Preserve neem trees and plant new trees. A few information about constipation. Number one, iron tablet brings temporary constipation. During this time, fruits should be taken more. Number two, during pregnancy, due to hormonal effect and expanding uterus pressing on intestine, temporary constipation occurs. If not forbidden by obstetrician, pregnant ladies should avoid idle life and take part in light domestic works daily. Walking, jogging, drinking enough water, fruits and veggies would help them in easy delivery of babies. Three, if time of taking food changes, temporary constipation may be seen. It will pass off. Try to take food timely. Number four, if urge to pass stool is not there, don't force to pass stool. Rectal muscles are very delicate, tear up easily, unnecessary trouble starts. Fifth, there is no much harm if stool misses 1 or 2 days. You may take warm water with lemon juice 2 to 3 times. Possibly it will do. Do not use douche unless it is imperative. Do not take douche off and on. Rectal muscles will go inactive in that case. 6. Do not practice taking purgative daily. This is not the way to fight out constipation. Fight constipation with proper selection of foods and body movement. 7. Whenever urge comes, try to perform the act as soon as possible. Do not procrastinate. 8. Urge to pass stool is a reflex arising from internal system. We have to oblige the same. We cannot dictate internal system. Of course, we can modify a lot of things by controlling items of food and time of taking foods, etc. If required, Take help of physician. Mind that, except in a few situations, medicine is not a thing to take regularly. It is a thing to take at the time of need. Follow lifestyle in such a way that natural foods and natural routine, that is diet and regimen, be your safety. Our present session ends here. You have gone through the whole session. Now please give your comments as to the quality of this presentation. How this could have been much better, what should have been added, or what should not have been added. I'll be waiting for you so that I can give you my best presentation in the coming days. Thanks for the time and attention.